Hello, everyone. Thank you so much for joining. And this is one of the summits that we have been working on for a few months when Valerie and I met with Apurv, and he has the vision to bring love and compassion to not only to the healthcare organization, through the world, I would say, but their main focus at the moment is healthcare summits, healthcare industry, because when we were discussing, we realized that healthcare industry is somehow needs some major fix because for too long we've seen that nurses and doctors have carried the weight of healthcare system in distress. So that's how we actually joined hands, and now we have created the summit to give you some insight that how you can learn to feel empowered to bring about the change in your community and in your career. So let's welcome and let's start. I think I'll just give uh, stage. I would say that this is the same stage, but I'll just say Valerie to say a few words and then to approve.
Well, thank you so much, everyone, for joining. Everyone who is here on live, as well as anyone who's listening to these replays. I think this is so important that we start talking about this conversation of healthcare and love and change. And the time is now. The time is now to continue to really promote this conversation. We have really joined hands with a loving organization to really essentially say, what can we do to help with the current state of healthcare? There is such need. As a nurse practitioner myself, I understand from the patient side as well as the provider side as well as the patient side. And we talked about back in when we met a couple months ago about how can we take this complex problem and make it more simple. And we decided to talk about the SOAP format and how, as clinicians, we address in patient form that there is an issue and we see an issue in healthcare. So let's bring the SOAP format to the systems. And that's kind of how this was born. And Apurv, I'll let you take the stage and tell us more about how we envision this and more about this concept itself.
Yeah, thank you. Good morning, everybody. Thank you so much, Valerie and Ambreen, for bringing us here. As you both were introducing this, I was just thinking it was only a few short months ago that we met. And I think what all of you are now experiencing and about to experience here today is really the power of love, which is now amplified by impact activators. That's the group that Valerie and Ambreen have started, which is truly powerful and palpable. It's amazing the energy that both of you bring into the world to make a difference. And again, when multiplied, with the mission that many of us are on here to help spread the message about loving organizations and how that's a alternative to the typical fear-based organizations. And how can we do that? What can we do about it? And we're all learning about it. It's a relatively new term and a new concept, although many would argue that organizations have been practicing it for a long time. It really hasn't been well studied or discussed. That's what our Loving Organization Consortium is about, and we're so glad that we have the power of impact activators to now bring this Healthcare Summit 2025 to life, so that this global stage virtually can experience this. To speaking specifically to your point, Valerie, about the SOAP note and what the promise that it has, our whole approach with the Loving Organization Consortium is about taking a systems view and looking at the organization as a series of systems. And for those of you who are listening, you might be wondering, well, what are some of those systems? Well, we have the people-based systems like leadership and teams, and then the staff themselves, as well as the community. And then we also have the non-people, the process-based systems. That includes things like the culture, the technology, processes, and workflows. as well as the management. When you bring all of these together, we've created a mnemonic for this we call integrate, and each letter stands for one of these systems. When you bring them together, they really represent the whole organization. And so thinking about the overall organization in these ways makes it a little bit more easy for us to understand how are we going to drive love into each of these components. They can either be run through fear, or we can, collaboratively and constructively make each of them infused with love. So we're trying to use the same approach for our clinicians out there, our doctors, nurses, pharmacists, therapists, mental health workers, and the like, to leverage the training that they've had in the SOAP note format. The SOAP stands for Subjective, Objective, Assessment, and Plan. And it's to leverage the power of diagnosis and skill that the clinicians already have through this format, and use that to help also understand what's going on with the system so that they can be participants in healing the system. So, it's a relatively simple approach, but we're hoping that it will resonate across disciplines and that it will unleash the power of clinicians to participate and really take charge in healing the systems. So with that, I guess I'll turn it back to you, Ambreen.
Yeah, thank you so much for actually adding to it. And we've created a short video. We'll actually give you some to kick off this actually summit. So let's play a video. So it will give you a brief idea that of introducing the summit, that what it is about and why we have created it. So let's watch our short video. I'll share. Can you see all of the screen? All of you can see?
Yes.
Okay.
Yes.
So it was just a brief, I would say, introduction that how clinicians are facing the stress in the system. And as like Apurv also said that, for long they've been like facing this stress, causing a burnout. And if we actually look at the number in 2021, we see that nearly almost 63% of the physicians reported at least one symptom of burnout. And if we see that 1 in 3 nurses has considered leaving the profession altogether, and the financial toll of the number alone is estimated to the cost of U.S. healthcare around $4.6 billion annually. And these are just not the isolated struggles; these are the systematic challenges that demand systematic solutions, and that's why we are here today, and that's why this summit matters. Because I think it is time now for new kind of leadership in healthcare. And it is just not the, as Apurv was also saying, that it's just not the one-time event. We also plan to do it, like to follow up and to create more events to continue the effort. So like we can actually do some meaningful work in the healthcare system to drive some meaningful change. And as Apurv and Valerie actually pointed out that, we have actually created a framework of especially the SOAP notes, which is, I would say, this language speak to clinician and to the patients as well. So I think I would say this is groundbreaking framework, which you or whoever is attending, maybe live, or even if they're listening to the replay, it will benefit you a lot. So you will be more empowered today. So I think in my opinion, this is not just a summit. It's just not the idea. It's about giving clinician and healthcare tools to reclaim their power as system architects, So the healthcare can finally reflect the compassion and the love, which, like, Apurv has this, especially this, the a loving organization consortium. This mission is to bring about the love and compassion into the system. So I think today it's just the beginning of the journey, and there's many more to come.
I'm so excited. And I just want to add, Ambreen and Apurv, a story that really I hold dear to my heart, that really I feel like reflects all of this. When I was a patient, also seeing it from the provider side, I one day was so upset, so frustrated at what was going on, at people being kind of just doing task-oriented things and not seeing me as a person. I was seeing staff to staff, not seeing each other as people. And I was just so kind of frustrated. But then the healthcare provider saw that in me. This one healthcare provider, this one day, she said, "Mom, I think you need a hug." And that hug made all of the difference. That day, I felt seen, I felt heard, and it was that simple act of love. And it was so powerful for me. And so I really feel like that story and that day made me want to do more with all of this, with advocacy, with love. How can we bring more love to healthcare, to each other, and less fear? So thank you so much, you guys. I'm so excited for this.
Apurv, do you want to say words there? So before we go to Henrietta, our first speaker.
I think there's nothing to say after what Valerie shared. Even such a simple story like that really just brings it home. So I would just say thank you so much, and thank you to all of you who are participating. Thank you to our amazing, amazing speakers. I'm just excited to listen, and I've got my writing pad ready to go and take notes and learn as much as we can. So thank you, everybody. Thank you, Valerie and Ambreen.
Yeah,
Thank you so much.
Thank you so much. It is really an honor to work with you, Apurv. In this short time, we were able to actually create something like this. So I'm so excited. So now let's start our first session of the today. That's with Henrietta. Henrietta is a biomedical scientist and entrepreneur with over 20 years of international experience in healthcare research and innovation. She's also founder and CEO of Objective Recovery, a startup applying neuroscience and technology to create personalized solutions for addiction and mental health. Having overcome her own struggle with addiction and mental health, Henrietta combines scientific expertise with lived experience to bring empathy and insight to her mission. Her work has been featured in top journals, recognized with prestigious awards, and highlighted in global media. She has also advised healthcare organizations on building science-driven sustainable solutions for recovery, behavior, healthcare, and system transformation. So let's welcome Henrietta for the first session. Hello, Henrietta. Thank you so much for joining us as a speaker today.
Hi, everyone. Let me share my screen.
Yes.
I have a presentation. That's actually, I think I'm sharing the wrong one.
No problem.
Can you see the
Yes.
slide? Okay. Okay, so good morning, good afternoon, good evening, everyone, depending on where you are connecting from. First, I would like to thank the organizers for this wonderful and much needed event and the warm introduction. So my name is Henrieta Szutorisz. I'm a biomedical scientist and entrepreneur, and I spent my entire career in healthcare, working on doing research and developing innovative solutions in different areas, such as virology, cancer, stem cell research, development, and in the past more than 15 years in the mental health field. I worked for both large healthcare organizations and on my startups in different countries within Europe, the United States, within Asia as well. So I have seen a lot of the healthcare systems worldwide. And my training background is in biology. I'm a biologist. So today I will discuss with you some of the problems, how I see the problems with healthcare, and how I see potential solutions to use modern science, technology, and integrate it with love to improve these systems. So probably we all can agree that the primary function of healthcare is to make people feel well and happy. And unfortunately, this is not the case. And this is there are many surveys being done on this, how satisfied people feel with their lives, with their health, and so on. And so this is just an example showing different countries. So it's quite alarming because this was a survey. In the survey, people were asked to score their life satisfaction on a scale between 0 and 10. And you can see that none of the countries even reached a score of 8. And for example, the United States didn't even make the first 50 top scores. So it's also there are also studies showing that less than 50% of Americans feel that they are thriving in right now in 2025. And this is also, according to studies surveys, this is a 5-year low. So it's instead of going up, which we were expecting after the pandemic's resolution, it's either stagnating or getting worse in general. So there is a lot of rising stress and loneliness and disconnection in the world. And this is kind of ironic because we have, on the other hand, on the other side, all this social media and wellness culture. So we speak a lot about this. There is less stigma in general about speaking about wellness and how we feel, and still it's not improving very much. So life satisfaction is continues to fall in spite of higher spending. So in different countries, generally, there is a lot of investment going into this, but it doesn't seem to help very much. So what are the main global health issues? I will just mention a few categories. So first of all, it is very well known, cardiovascular issues, diabetes and cancer continue to lead the health problems worldwide. So there have been many developments for these, and there are many wonderful treatments, and both pharmacological and medical devices, and a lot of personalization is also going into this, but it's still not, these issues are not far from being resolved. Now, there is something a bit newer in the last 10 years, I would say. We speak a lot about lifestyle and what our lifestyles can be affected by, and how that relates to our physical health, mental health. So we speak a lot about, probably everyone heard about inflammatory conditions, metabolic conditions. Obesity is still an epidemic in most countries. So this is also, and these problems are known to be affected by stress and disconnection. So it's not surprising that it's not getting any better. Now, the mental health part. So as I mentioned, I'm in mental health now. So depression, conditions like depression, anxiety, and addiction are the leading causes of mental health issues, but there are many others as well, and we will get into this later. And finally, there are also problems related to the environment. We speak a lot about climate change, which definitely causes, it makes just life and the world more erratic, which is increased affects people's well-being. Pollution and infections contribute to this. So we definitely have a global health crisis. And what is interesting is that almost 80% of the people globally believe that both mental health and physical health are equally important. Yet, more than 60% of people feel that they have felt stress to the point where it had an impact on their daily life and functioning. And about 40% say that these people couldn't even go to work for a period of time, or couldn't function on a basic level. And there is also a lot of talk about different generations these days, and so the stress seems to affect younger generations more than older people. So this is again alarming because those people are our future. So and they have these issues. So now on the mental health front, depression is one of the leading causes of disability in the world. About 300 million people in the world struggle with depression still. And this is a very large number considering the world's population is about 8 billion, so it's quite a lot of people. But even if we don't care about people, sometimes healthcare is guilty of that. These problems, mental health problems, physical health problems, altogether affects the world economy. And just simply due to depression and anxiety, there are it's estimated that about 12 billion days are lost due to a loss of productivity because of depression. And the cost, the worldwide, the global cost of mental health, these mental health issues for the economy is estimated annually about 1 trillion. And so if this continues to rise or stagnate, it's a very, very dire outlook for the coming decade. So why is healthcare not helpful enough? Because that's supposed to be the function of healthcare, right? To solve these issues. So there are rising costs, and there is a lot of investment. So I have a very strong startup background, and we always talk about investment. So there is a lot of investment going into healthcare solutions, innovative solutions, but yet the progression stagnates. So it's still not resolving. It's simply spending money. It's not the solution, definitely. The mental health is definitely one of the main issues. So more than 50% of mental health problems continue to be untreated. It's either because people don't have access to mental health care, or there is just no real good solution to it, especially in the long term. Now, there is also how on the individual level, many patients don't feel recognized as a human. They feel treated as a number. They have to go out of the door when they have an appointment in a few minutes, and so it's very focused. Everything is very focused, and so very little is addressed in a healthcare appointment and in healthcare system in general. But of course, this is not surprising because we also know that many providers get burnt out, and due to the many issues that we will discuss today. And of course, if the providers are unwell, how can they provide good health care? So this is really just very basic issue. And this provider burnout, I speak with healthcare practitioners every week. And I hear at least one or two, and most often more cases, people complaining, healthcare providers complaining about feeling burned out. And this is also one of the main causes of leaving the professions. So this is not good. So what is this related to? So in my opinion, again, as a biologist who studied, how the body works and how the mind works, and trying to put all this together. So recognizing the body as a complex system is not usually a problem these days. Even just everyday people who have no knowledge about medicine and biology know more or less that we need to approach it with a more holistic lens. But the body is not the only need, of course, and this is where the problems start to become very clear. So this chart just shows the different dimensions of wellness. So we spoke about the mental health, the emotional factors, occupational dissatisfaction. So again, healthcare providers, everyone, if we are not happy with our jobs, then we cannot function and provide care sufficiently to others. There is also all the problems with the environment. So these are not individual problems. Definitely, we speak about systems. So these are systemic problems coming from the environment. And all this causes a lot of dissatisfactions, of course, on the social and even spiritual level, meaning that people don't feel fulfilled. They don't feel that they reach their full potential. And this affects everyone from, doesn't really matter if it's a patient or provider or anyone in the world. So let's look at the foundation of health. What does it mean to be healthy? So again, as a biologist, I like to discuss two main components of this, which is everyone has heard of the nature and nurture concept. And nature is basically what it's usually the physical, physiological elements that many of these can also be inherited, what they bring into life. And then there is, so there's a picture just shows that development. So it's very well known that the development is especially early development is very sensitive to environmental effects and to nurture. If it's lacking, if love is lacking, nurture is lacking, it causes so many different problems. I studied this even intergenerationally. So that's again very alarming because we can't even make sure that the next generation will be healthier if the system changes in 10 years. So we really need urgent solutions. So all these stresses and traumas disrupt the whole system, again, both the human system and the healthcare system and the world system on many different levels, causing a lot of disconnection and disease. So what can be the solution? So it was mentioned in the introduction that we speak about the power of love. And so I have done a lot of research in the neuroscience field and studying, for example, how people get motivated and what it means to be nurtured, to feel loved. And I always like to say that love is actually a biological reward. It's not just an esoteric vague concept that we just throw around. This is a very basic need that is imprinted, ingrained in our basic biology. And so there are different, it's quite a complex network how love and nurture is incorporated into the brain's function. And a lot of these functions are regulated on the unconscious level. But we also, since we are humans, we have our consciousness and intelligence. So we can use that, and we need to use that more to recognize these issues and to improve these issues. So all this chronic disconnection, even in the brain, so it just shows that everything even in the brain on the physiological level works via connections. In the brain, it's chemical signals, so neurotransmitters, and electrical signals, so connections, and everything is interconnected. But this is true for the whole of human life and the world. And so all this chronic disconnection very often mimics pain. And it's not only mimics, but it can directly cause pain. People suffer with it. Used to be called psychosomatic pain or psychosomatic issues, but we know at this point that it's not just imagination. It's not just in the psyche, coming from some kind of vague source. So it's connected to all these physical issues. And so lack of emotional safety increases inflammation, which is also related to stress. And all this chronic dissatisfaction disrupts brain function. And so systems without love deplete both providers, patients, and pretty much everyone in the world. So again, we have to start on the very basic level with ourselves, on the individual level, if we want to resolve these issues. So what is change hard then? So I think we can all agree that these systems need to change. But so why is this not happening? We definitely talk a lot about this, but it's still we're going very slowly, and sometimes it's going in the opposite direction. So again, from my background as a biologist and as a neuroscientist, I like to relate this to how habits work. And so habits, probably everyone is aware that habits are basically a cycle and a very important component of developing, changing habits. If you want to change a bad habit and develop a new one, is the component of reward. So I just mentioned that love is a biological reward. But when we want to change the healthcare system, the question is, how can we incorporate love? How can we make love as a reward for people, for both providers, patients, and everyone? So this is still not happening. We are still at the level of just talking about it. So in my opinion, it's very hard to change complex system by just talking and focusing on feelings. So how can we do it then? So again, going back to the biology. So everyone knows that we are supposed to live a healthier lifestyle, especially because we have so many good resources for this nowadays. But what does it mean? How can a healthy lifestyle achieve change on the biological level? So two major mechanisms that I like to mention as a biologist that are influenced by nurture and environment is the first one is epigenetics. And so probably many people are familiar with what that means. So it's basically genetics is the DNA that we inherit from our ancestors, our parents, that is given. We can't really change that too much. But epigenetic, it means epi, a Greek word above the genome. These are mechanisms, biological mechanisms that regulate how the genes function, how everything is manifested based on that inheritance. And this definitely can be influenced by environment and lifestyle. Another one is neuroplasticity, which is just the property of the nervous system to change on many different levels. Again, this is very responsive to environment and experience. And so many people that don't know, in my experience, that love and nurture actually directly affects these mechanisms. So it's not just an esoteric soft concept speaking about love and the necessity of love. So what can we do in terms of solutions? So I work a lot on personalized and holistic wellness solutions. And I think the very first line in any problem solving in this area is developing an in-depth assessment that addresses unique backgrounds and needs for people. Now for this, since healthcare already is using so much data and information and measurements, we definitely can use this data, but we need to use this better. And so I work a lot on, for example, how we can utilize biomarkers that can be collected, information collected from physiological bodily measures, blood works, and so on. How we can integrate this with psychological factors to create an individual map for a person as a start. I'm a very big fan of newer disciplines such as functional and lifestyle medicine, because the goal of this is to integrate these holistic solutions and to provide and also view this as a progression and as dynamic processes in time. The problem is that some of these providers, these types of healthcare providers are not covered by insurance, for example, in the United States. So we need to change those systems as well. And also speaking of mental health, there is also still law that mental health practitioners can actually lose their license if they get diagnosed with an actual mental health condition. And this is very serious. So how can this persist? This is so archaic and so still. It's basically, we are penalized, we are punished for seeking help. So we definitely need a better integration of all this data collected from the body and add psychological and behavioral factors. So this is now relates to the SOAP network that was introduced in the beginning, both objective and subjective factors. And speaking of technology, technology, many people are very afraid of technology these days. And of course, it's associated with many threats. But we can also, I don't think that we need to approach it with that mindset. It's much more productive if we think about how technology can help us and healthcare and the world. And so in terms of healthcare, digital technology can definitely provide improved access via digital apps and that providers and patients can use. Technology can detect physical problems early and even mood and stress early. So just one example to mention, I'm sometimes involved in projects where we use the smartphone to basically measure how people use a smartphone and how they interact with their smartphone. That's part of our environment, right? And so that data can be used to analyze people's emotional state and behavioral state. And so this can be transferred to providers and integrated into the global picture of someone's wellness. Most of these technology systems now use AI systems. So I mentioned how it can support the health and wellness, but it can also support providers directly via giving easy tools to make administrative processes easier. And of course, we need to make all these technologies ethical so that they can empower humans, not replace them in the end. So again, how can love help healthcare? So what we need is a patient-centered and collaborative healthcare solutions. And so I mentioned the technologies. And so again, based on the SOAP network in the beginning, so there are both the objective factors that we can collect a lot of data from the body. But these days, we need to use more these technologies that patients can take home and providers can take home, because in the end of the day, providers are also patients sometimes. They also need to take care of their health. So that's for everyone on the very basic level. So we can take these technologies home and they can work in the background. We don't even need to be aware of what's going on. And it's part of the system that analyzes this data and connects to the provider. And so these systems usually also make it easier for providers to access patients and to monitor patients' well-being and how they do with a new medication, how they do with live communication and everything on a daily basis. And so again, more connection. But it's very important to create also integrate good balance into this, because of course we don't want to get obsessed and addicted to these technologies. Nobody. So how can we do this in practice? So I will, in the end, this is my last slide. I will just give you an example from the company that I'm leading at the moment. It's called Objective Recovery. So we provide, we create individualized, personalized, and holistic strategies for addiction recovery specifically. And so just very briefly, we use both biomarkers from the body, so such as genetics and other blood work information. And we have a behavioral assessment that can also, quite innovative ways, can analyze where someone's problem is coming from, someone's addiction problem is coming from. So this is not at the moment for addiction, but it will probably will be there is a probability that it will work. It can work for many different mental health issues. And so if you want to learn more about this, you can look at our website, objectiverecovery.com, and we also podcast, which is on live on YouTube and TikTok. So this is the end of my presentation, and I'm happy to take questions.
Yeah, thank you so much, Henrieta. It was such a wonderful presentation. You covered very comprehensively all the aspects that how the entire system is created in a way that it is affecting patients, and it is also affecting healthcare provider. And what are the solutions? So I think it's really amazing and eye-opening. So I think now it's time to move to another presentation, which is now Claudia and Kelvin's presentation. And for that presentation, you need to click onto the link, which Valerie has already provided in the chat. So I think it's better that we go to the other Zoom link. So there to continue the session. Thanks to everyone for joining and listening. And thank you so much, Henrieta, for sharing such a wonderful and eye-opening presentation. Okay, so see you to the
Brilliant.
other
Thank you.
Zoom link. Okay.
Thank you, Henrietta.